Hey mamas, happy day to you. I hope all is going well. If you have not met me in the past, my name is Jenny Gablesberg and I am a pelvic health physical therapist and really have dedicated my career to helping all individuals with any type of pelvic health challenges, but I really love working with the pregnant and postpartum mamas. So that is what we are going to chat about today. So I want to know, prior to your delivery, or if you are still pregnant, just knowing, answering, do you know about this at all? But prior to your delivery, were you ever told that things like urinary incontinence, pelvic organ prolapse, diastasis, pain with sex, any of those really common postpartum challenges that women struggle with, that was a thing, that could happen? Anybody? Anybody? Leave me some comments and say, yes, I knew, and I didn't think it would happen to me, or nope, never heard about it, nobody talked about it. Absolutely unbelievable. So, about a month ago, I went to have a pelvic ultrasound done. And I had this darling, young, obviously pregnant woman kind of rush into the room. She was the ultrasound tech, and she's a little out of breath because she looks end of second, beginning of third trimester pregnant. And obviously, she's been rushing up and down the hallway, so she's catching her breath a little. And we start talking. And as she's doing my ultrasounds, I asked how far along she was and who was her doctor and kind of those sorts of things. And I said, oh, I'm a pelvic health physical therapist, and I work with women who have things like incontinence and prolapse and pelvic pain. And she looked at me a little horrified and said, you mean pregnancy and birth can cause those things? And I thought, uh-huh. Yeah. And, in my world of doing pelvic health for the last 26 years, it's a given. But when I think back to when I was pregnant with my first child, I did know because I was a pelvic PT, but if I had not decided to specialize in pelvic health, I'm not sure I would have known that was something that could happen. I mean, we all think about after having a pregnancy and birth, you've got to work on getting your core back together. And we really just think about abdominals and forget that there are a lot of other muscles in our body that have undergone changes during pregnancy. But I was really hoping that she would have known something like this, um, because she was an ultrasound tech and she also was starting nursing school. So I am hoping once she gets to the OB section of her nursing training, that is something that she is taught about. But at this point, absolutely horrified. Had absolutely no idea that this was something that could happen to her. And locally here in Southern California, I was speaking with one of the urogynecologists that I work with quite a bit. And if you don't know what a urogyn is, they are professionals who have gone through the training to become an OBGYN. And then once you're an OBGYN, you actually can choose 3 paths of specialty. So a urogynecologist works with pelvic pain and prolapse. So they do an additional 3-year fellowship. There is gynecologic oncologists. They do another 3 years. So they are our gynecologists that focus on treating any type of gyn cancers. And then there is a newer specialty called a MIGS, minimally invasive gynecologic surgery. That is a 2-year fellowship. And so these are individuals that have done extensive training in learning how to treat the problems that happen with pregnancy and birth, to be frank. They're the ones doing prolapse repairs and those sorts of things. So we were just having this discussion about that she had had several talks with the nurses at the hospital where she worked, the prenatal and postpartum nurses, and really wanted them to offer some education to our mamas on these are things that could happen. Because if you have no idea that these things could happen, and then they happen, obviously it's going to impact your mental health that you're struggling with these things, especially if you feel like you're the only one in the world that has these things. You didn't know what was coming. And the nurses really just refused to give any of that education. And their concerns, which I do understand, is they did not want to promote fear. So, as a pelvic PT, one of the things that we really are cognizant about is not creating a perception of threat. We don't want you to think that vaginal birth is threatening or dangerous because it's not. But could you have some musculoskeletal changes that need to be addressed? Yeah. There are really common things. 33% of women leak urine. The biggest risk factor for leaking urine is a vaginal childbirth. Now, do not let that scare you into having a C-section because there are other challenges with C-section. So what you want to know is that there could be some challenges. What are the things I can do to prepare myself for birth that might help? What are the things that I need to be doing immediately after birth? And especially focusing on some intentional training in those first 12 weeks to get things kicking back in the way that they are supposed to. So what we don't want to happen is to have women struggling with these challenges, whether it's leakage, bladder leakage, or bowel leakage, or pain with sex, or a feeling of heaviness and falling out around the vaginal area, or a diastasis that is creating some pelvic pain or some inability to get back to exercise. We definitely don't want anybody saying, oh, I can't get in the bounce house with my kids. I can't go back to running or CrossFit or volleyball or basketball or any of those kind of impact sports. We want women to feel really good about their ability to get there. But it's not just about jumping into the things that you used to do and going straight to that. We also don't want mamas to get stuck for the next 10 to 20 years wearing pads. You know, we're used to wearing pads monthly if you choose to wear pads or tampons or cups, whatever you're using. And after baby, we certainly get used to wearing pads just to manage all the blood that happens, the lochia that is happening after childbirth as our uterus shrinks down and heals. But we do not want to now have to wear these little sanitary or continence pads every single day of your life to help manage leaks. Okay, that's not acceptable in my world, and really would love to see that changed. One, because we just don't want anybody to have to do that, but two, they're bloody expensive. It's like $1,200 to $1,800 to buy pads if you're wearing them every single day. So we just don't want any of those things to happen. So part of the struggles in postpartum challenges is first, like what we spoke about, is some women are never told that these things are common. Some people know that they are common, but think, oh, they won't happen to me. Some people know that their mom leaks and their grandma leaks and their auntie had surgery for a bladder prolapse, and they just assume that it's something that they're going to have to live with and that there is nothing to do about it. Well, none of those things are okay, and I want all of those things to change. But when it happens postpartum, the problem is there's no structured, intentional, focused guidance on how to get those muscles to kick it in again. What exercises should I be doing? How many of them should I be doing? How long should I be holding them? How do I progress them to things harder? How do I get myself back to CrossFit or competitive volleyball or being able to play in the adult soccer league or getting through yoga class and trying some of the advanced yoga postures? Don't know. So I'm just going to kind of try to go back to it and see what happens. If somebody has back surgery, very often they are told, just start walking. That's all you need. Just start walking. You will get back to normal. You'll do great, but you got to get up and move. So the getting up and moving part is really important. But what they're missing is when you look at the research, there are these little muscles that I don't have a full spine here, but if you can envision the spine coming up more, we have these little muscles right on the side of the spine that go all the way up. They're little tiny, they're really deep, and they're called the multifidus muscles. Well, these muscles act automatically when we lift, when we cough and sneeze, when we do any type of sudden movement. So they are what we call pre-contractors. They tighten down to stabilize this area to make sure you don't get injured. And what the research shows is within 24 hours of a spine surgery, these guys atrophy. They get smaller, they get weaker, they're not activating on their own. So with a back surgery, you need specific, focused, intentional, finesse exercises, really focused for these multifidus muscles. So you're not still having back pain years later. So you're not coming up with some new dysfunction because your movement patterns have changed and you can't manage things like carrying in 14 bags of groceries at once, lifting up the 30-pound bag of dog food, lifting up strollers and car seats and all the things that we do as moms. So in that case, in those back surgery patients, they really need some focused work. It is not any different in our new moms. So we need to really have commitment to daily focused, subtle exercise. So it is great to be getting back to some walking or some elliptical or maybe some running, depending on how far you are out, some of those higher level activities, because it's good for your brain to keep your sanity when you are learning to parent. It is good for your heart. It is good for your lungs. It's good for your bone density. We like those things, but you have to reserve at least 10 minutes every day, really consistently, for focused, intentional, subtle, sometimes a bit tedious exercises to retrain the deep core muscles. So I want you to keep that in your brain. Daily commitment, 10 minutes are deep core, subtle exercises. And the next video you're going to see from me is going to talk more about that. Why is it important? Which muscles do we need to focus on? And what we call pressure management or load transfer, kind of what that means. So there's your little teaser. Come hang out with me next time and we will talk all about that. But in the meantime, if you are pregnant, I want you to know that there are some common postpartum challenges that happen when our muscles get lengthened. Some get torn, some get cut through, some get shortened during pregnancy. But those are all things that can be addressed by focused intentional work. If you are already postpartum and struggling with some of these things, you can still help address them with focused intentional work. I work with mommies from the very beginning after birth, but also see them 20 years after birth. I had a gal who had a son turning 28, and yet she had not sat on a regular seat without a cushion for 28 years because she had been having coccyx pain that entire time. That should have been addressed. Nobody ever said, there are things you can do about that. That's probably a muscle problem. Let's think about that. I don't want anybody struggling for a long period of time. I want women to be able to access really structured, intentional, focused, tedious exercises, especially in that first trimester, that fourth trimester postpartum. But anytime in those first few years, if you are struggling with any of those really common concerns, I want you to know that they are treatable and that there are things that you can really focus on to get resolution. So come hang out with me next week and we will talk more about the details of that. All right.